Hello, I'm Dr. Paul Russell. I'm the Medical Director of the Santa Clara Valley Medical Center's Ambulatory and Community Health Services Division. I want to talk to you about 3 videos that are very important for you as a provider of prenatal care services to watch. Research has shown that the use of alcohol and drugs transcends all economic groups and all ethnic groups. The videos will talk about the effects of alcohol and drugs on the developing fetal brain. They'll talk about the importance of universal screening, and we'll also talk about the treatment resources that are available for women who are using alcohol or drugs during pregnancy. So I encourage you to watch these videos and incorporate what they are asking you to do into your daily practice with your pregnant patients. Thank you.
This is a picture of 2 brains from babies about 6 weeks old. The baby on the right died from sudden infant death syndrome, while the baby on the left died from prenatal alcohol exposure. Alcohol-exposed brains can be smaller, have underdeveloped, or even missing parts. Alcohol also stops the growth of folds on the brain, as demonstrated by the brain on the left, which is more flat. Because alcohol damages the brain, the effects do not go away with age and have the potential to be lifelong. Many risks that come with pregnancy are inherent and unpreventable, but you, as healthcare practitioners, have the opportunity to inform and educate women about the risks associated with using alcohol, tobacco, and other drugs during pregnancy. The use of alcohol, tobacco, and other drugs is the leading cause of mental retardation in babies. As for how that affects society, per research done in 2003, and upwards of $2 million is used to meet the needs of a person with fetal alcohol syndrome caused by drinking over their lifetime for medical, educational, and social needs.
The term alcohol refers to beer, wine, liquor, or any drink with any amount of alcohol content. Binge drinking is especially harmful, though it's important to remember that no amount of alcohol has been found safe for consumption during pregnancy. The National Institute on Alcohol Abuse and Alcoholism defines binge drinking as the consumption of 5 or more drinks in 2 hours or less for a male and 4 or more drinks in the same time frame for a female. The effects of prenatal alcohol use are lifelong for a child and can affect their education, IQ, social skills, and more, as listed on this slide.
We think that one of the reasons that well-educated Caucasian women are drinking in their 3rd trimester is because they've made it through their first 2 trimesters fine. The doctor said the baby's developing well, and so they think, oh, why not have a glass of wine with dinner? I won't hurt my baby. And because we don't know how much alcohol is safe during pregnancy, we recommend that no alcohol be consumed. There are studies that say as little as 1 drink per week can affect an unborn child.
The diagnosis of fetal alcohol syndrome falls under the umbrella of fetal alcohol spectrum disorders, which was developed and defined by healthcare experts in the early 2000s. Fetal alcohol spectrum disorder is not a diagnosis and describes a variety of effects of prenatal substance exposure. Remember, fetal alcohol spectrum disorder is 100% preventable. The many issues we see with people affected with fetal alcohol spectrum disorder include issues such as information processing, which is when we see people who have difficulty taking in, storing, recalling, or using information appropriately. Sensory integration is the body's response to stimuli. Those afflicted with fetal alcohol spectrum disorders may experience overstimulation or understimulation or have issues with body space. For example, an individual might perceive a gentle touch as an attack. Memory, or the ability to recall information, or the sequencing of events may also be impaired. Executive functions are those involving planning and problem solving that allow people to function in everyday life. Self-esteem and personal impairments may be evidenced through uneven function at school, work, or in a social environment. Other issues include a tendency to be easily bored, difficulty in changing tasks, or struggles to read social cues.
Yeah, so when you talk about doctors screening for alcohol and other drug use, many physicians have not had the kind of training around addiction treatment that they have around many other issues. So it's often not on the radar screen for them, and also when they're busy, it's hard to find the time to ask questions about something you're not too sure of. Especially people with alcohol or other drug problems, they don't welcome you talking about that. So even if you're good enough to ask, patients often turn you off from asking. And so many times doctors don't ask because it's just easier not to raise it because they don't feel confident about it, and also patients don't encourage you to ask the questions or want to even know the diagnosis.
So many times people don't understand that alcohol can be really dangerous during pregnancy. It used to be that women were advised to drink wine when they were pregnant to relax or to help them with breastfeeding. They didn't realize that alcohol can cause catastrophic problems in a baby. And they also didn't realize that there's a whole range of problems that can happen with alcohol use during pregnancy. The most severe is called fetal alcohol syndrome. And in this, there's actually changes in the way that a baby's face looks, where you can recognize alcohol exposure from that. It's called a teratogen because you get birth defects from it. But the face is really not the big problem because there can be damage to many organs in a baby's body. The heart could be damaged, there could be problems with vision or with the kidney system. But I think the really tragic thing is the risk for mental problems, the risk for having damage to a child's ability to learn, and damage in a way that makes it difficult for them to live independently later on in life. They may not be able to handle money, for example. They may not be able to make good decisions about many things in their life.
In the case of marijuana use, babies exposed are more likely to suffer from attention disorders and learning problems later on in life. They can develop issues with problem solving, cause and effect relationships, and have lower reading and language skills. Long-term effects of methamphetamine use can be seen in school-age children. These may include learning difficulties, developmental delays, negative behavioral patterns, irritability, hyperactivity, attention deficit disorder, and fits of anger. We usually do not see the effects of cocaine in children until they reach school age, at which point we commonly see deficits in learning. The effects of tobacco are very similar to all the other drugs that we have just discussed. It is important not to emphasize low birth weight as an effect because this can be a positive outcome in some women's minds. Other effects include attention deficit hyperactivity disorder and sudden infant death syndrome. Smoking during breastfeeding is also not recommended because nicotine reduces milk production and passes through breast milk, which could cause restlessness, increased heart rate, vomiting, and diarrhea in the baby. Secondhand smoke is just as harmful to a baby and can increase the risk of ear infections, allergies, asthma, pneumonia, and sudden infant death syndrome.
If a woman has been drinking alcohol before she gets into care, I think the most important message to that woman is not to drink anymore, because how much alcohol it takes to damage a baby is very variable from woman to the next. So, one woman may drink a little bit and not have any problems, and another woman drinking the same amount, the baby could have significant problems. So if a woman's been drinking either around the time of conception or after she found out she was pregnant, it's important for the OB provider to know that the baby's been exposed. It's important for the pediatrician to know that the baby's been exposed so that they can be watching the baby for signs of alcohol exposure. And it turns out that if a child gets help early, the outcome is better.
Many women and healthcare practitioners have misconceptions that drinking a little alcohol is okay. No amount of alcohol has been found safe for consumption during pregnancy, and we need to give this message consistently to all of our patients.